A woman not becoming pregnant despite trying is a condition that millions of couples around the world face, and it is often misunderstood because people assume pregnancy is only about timing, but in reality, there are many complex biological, medical, and lifestyle-related reasons that can prevent a woman from conceiving, and understanding these causes is the first step toward awareness, treatment, and emotional support, because infertility is not just a personal struggle, but a social issue that can deeply affect mental health, relationships, and family life. And medically speaking, the most common cause of infertility in women is related to ovulation problems, meaning that the ovaries do not release eggs regularly or sometimes not at all, and this can be due to hormonal imbalances like polycystic ovary syndrome, PCOS, which is one of the leading causes of infertility worldwide, where the ovaries develop multiple small cysts and fail to release mature eggs, making it difficult to conceive. And apart from PCOS, other hormonal conditions such as thyroid disorders, hypothyroidism or hyperthyroidism, or high prolactin levels can disrupt the natural cycle and prevent ovulation, and in many cases women may have regular periods but still not ovulate, a condition called anovulation, which often goes unnoticed without medical testing. And another major reason is damage or blockage in the fallopian tubes, which are the delicate pathways that carry eggs from the ovaries to the uterus. And if these tubes are blocked due to pelvic inflammatory disease, untreated sexually transmitted infections, past surgeries, or conditions like endometriosis, the egg cannot meet the sperm, and fertilization cannot take place. And endometriosis itself is another important cause, where tissue that normally grows inside the uterus starts growing outside, leading to painful periods, scarring, and sometimes distortion of the reproductive organs, all of which can interfere with conception. And age is also a critical factor because as a woman grows older, especially after the age of 35, the number and quality of her eggs naturally decline, making conception more difficult. And this is why doctors emphasize early awareness and timely planning for women who want children. And lifestyle also plays a huge role because excessive stress, obesity, extreme weight loss, eating disorders, smoking, alcohol, drug use, and even lack of sleep can all contribute to hormonal imbalance and reduce fertility. And while many people believe infertility is only a woman's problem, in reality nearly 40 to 50% of infertility cases are due to male factors such as low sperm count, poor motility, or abnormal sperm shape, which means that infertility is often a shared issue. But women often face the heavier social stigma, and this stigma adds psychological pressure that can itself worsen the problem, as stress hormones like cortisol interfere with reproductive hormones, creating a vicious cycle. And sometimes women cannot get pregnant due to structural problems like fibroids, uterine polyps, scar tissue, or congenital abnormalities of the uterus, which prevent the embryo from implanting properly. And other times autoimmune conditions cause the body to attack its own reproductive tissues or embryos, preventing pregnancy. And miscarriages are also a form of infertility where conception happens, but the pregnancy cannot continue due to chromosomal abnormalities. Health conditions like diabetes or uncontrolled hypertension, or immune-related issues, and unfortunately in many cultures, women are blamed unfairly even when the problem lies elsewhere. But the truth is that infertility is a medical condition just like any other, and with modern treatments such as hormonal therapy, surgery, in vitro fertilization, IVF, intrauterine insemination, IUI, and advanced reproductive technologies, many couples are able to overcome these challenges. But treatment is only possible when awareness exists, and awareness begins with breaking the silence, because millions of women suffer in private without knowing that their condition is common and treatable. And raising awareness about why a woman might not get pregnant helps reduce stigma, encourage timely medical consultation, and give hope because the causes are many. Hormonal imbalances like PCOS or thyroid disease, structural issues like blocked tubes or fibroids, lifestyle factors like stress and obesity, age-related decline, immune disorders, infections, or male factors. And the solution is rarely simple, often requiring medical support, emotional resilience, and family understanding. But what matters most is shifting the perspective from blame to care, from shame to support, and from ignorance to knowledge, because infertility is not the end of a woman's worth. It is a medical challenge that with proper awareness and treatment can often be overcome. And even when it cannot, it does not define the value, dignity, or strength of a woman. And so the reasons why a woman may not become pregnant are complex, varied, and deeply human. But understanding them in detail gives us the power to treat them with compassion, science, and hope.